will be recorded, and also you will be receiving copies of the PowerPoint after the session is over. So it's my pleasure to introduce our speakers tonight for an overview of Day and Employment Services. We have Heather Lomartire, who's Vice President of Employment and Day Services from the Charles River Center. And Heather started working at the Charles River Center in 1995 in the Day Habilitation program, and then later transferred to residential services, where she worked while getting her master's in education from the University of Massachusetts in Boston. While at residential, Heather was promoted to program supervisor to program director to then residential director. She became the clinical director at the agency and then moved to vice president of employment. Heather has a bachelor's of psychology from Framingham State College and is a board-certified behavior analyst. Then we also have Carol Alden, who's vice president of Day Habilitation, and Carol joined the Charles River Center in 2010 as vice president. Carol received undergraduate and graduate degrees in communication disorders from Montclair University in New Jersey. She's worked as a speech and language pathologist in a variety of settings: public schools, home care, acute hospital settings, inpatient and outpatient rehabilitation hospital settings, and nursing homes. For many years, Carol was Director of Speech and Language and Hearing at New England Sinai Hospital, served on the Legislative Council of the American Speech Language Hearing Association, and then worked as a case manager for individuals with traumatic brain injuries. So welcome and thank you to Heather and Carol, and I'm just going to pass the ball to you, so let's get started.
Okay, thank you, Carrie. This is Heather Lomartire, and we just wanted to thank you for this opportunity. We're really excited to present Day and Employment Services. Carol is actually going to get started talking about developing a vision.
Hi, everyone. This is Carol Alden. So developing a vision, it's done with the team, which is very important, the team including the family, including the school, DDS, professionals. It's to be done at 14 years of age, but by law it must be done by 18 years of age. It can be revised between there and the age of 22 if necessary. And it's to develop a person-centered plan. To develop the vision, they want information regarding the home setting. We want to know something about the day setting. How does the person spend their day? Transportation, how has transportation been successful? What has helped make it successful? We want to know information about community integration. What opportunities has the person had? How did they do? What were the settings and so on? Communication. We want to know information about how the individual communicates, but we also want to know how the family likes to communicate, how they prefer to have information shared, and so on. Relationships, very important. Basically, we want to know who's who in the person's life. Who do they have strong relationships with, who advocates for them, and so on. And then goals. There are short-term goals, which are things that can be accomplished in a few months or a year, and then longer-term goals, which are the bigger picture, where we're trying to go, and more generally stated. Another consideration for employment also is time and availability for the work setting that might determine what sites they could work in. So developing the vision, again, it's a team activity. Then we want to have a personal profile. That's developed with DDS and as part of the transition plan. So develop a history of personal life story. Include the background of the person, talk about critical events, medical concerns, relationships. Describe the quality of the person's life, so consider community participation and presence, choice, rights, competence. Then preferences of the person, document their interests, their likes and their dislikes, how they like to spend their time, and always focus on strengths. So rather than what a person can't do, what is it that a person can do? What do they like to do? What do they have in terms of skill sets? And what, with a little bit of help, they could probably do better. So in terms of developing the personal profile, again, this is done as part of the transition plan and is done as a team. Okay, I'm going to pass the phone to Heather, and she's going to talk about types of funding sources.
Hey, so you're figuring out your vision, figuring out what types of services for the individual as they move towards adult services, and you got to figure out what types of funding sources. So the next couple of slides, we're going to talk about those. And there's Mass Health for day habilitation only. There's also DDS, the Department of Developmental Services, Mass Commission for the Blind, Mass Rehabilitation Commission, and also some families have private paid as well. If your families or schools or anyone's having difficulty accessing services or just not sure which services to start with, you can always go to the Client Assistance Program, the CAT program, for information and referral sources. And this wasn't actually added at the end of the PowerPoint to locate it, but if you Google Client Assistance Program, Massachusetts, you'll be able to find out information on how to access that program. And they can help you lead through this process and determine where you may want to start when you're looking towards funding sources.
Okay, so the next slide is Mass Health and the Day Hab service. So it's an entitlement program. Eligibility requirements must be met, so any person who has Mass Health coverage and meets the entrance or admission criteria for the program is eligible. Transportation is included in the Day Hab services and will be applied for by the Day Hab program. This is one of those things that we do the upfront work of submitting the application, and we wait. And then we hear back about how that's all going to happen and what route the person is assigned and so on. So it's a little bit out of our control, but we interface with the transportation companies. The scope of services in a Day Hab. So nursing and healthcare supervision is a big part of what we do, and we also work on developmental skills training. As another service that's provided, we have therapy services in a consultative model. So that includes occupational therapy, physical therapy, speech language pathology, and behavioral health services. The Day Hab provides assistance with activities of daily living, and the Day Hab also provides case management. That's done through the program and in collaboration with the rest of the team, including the family.
And if you're looking towards funding through the Department of Developmental Services, as a person's approaching 22, even if they're already affiliated with DDS, a 688 referral needs to be made to DDS, and that should happen at least 2 years beforehand. So before they're 20, but it should happen a little bit before then. Massachusetts law, Chapter 688, which is also known as the Turning 22 law, this was enacted in 1984, and it provides a planning process for young adults with disabilities as they're transitioning from special education to adult service programs. And this supports the team to provide an individual transition plan as students are approaching adult services. To be eligible for Chapter 688 services, a person must be receiving special education paid for by the Commonwealth of Massachusetts, need continuing habilitative services at the time of turning 22, and habilitative services is basically just showing progress from receiving services. and also be unable to work competitively without specialized supports for more than 20 hours per week at the time of leaving school. And a 688 referral submitted by the local school system, and also an individual is automatically eligible for 688 services if they are also receiving SSI, SSDI, or if they're registered with the Mass Commission for the Blind, MCB. So as you approach and become eligible, a DDS coordinator will conduct a MAS cap, and that helps them figure out prioritization. And the MAS cap is the Massachusetts Comprehensive Assessment Profile, and there's two tools that are filled out. The ICAP, the Inventory of Client and Agency Planning, and that tool assesses individuals' adaptive functioning and the level of support and supervision that person may need. And they also fill out a consumer and caregiver assessment. And this tool assesses the resources and supports that are currently in place and what they might need for the future. And this information is analyzed, and the team at DDS, using the tools, will then determine prioritization for funding for adult programming. There's also two laws that were actually passed recently in the last couple years. It says Real Lives Bill and Autism Omnibus Bill, but they're actually laws. And the Real Lives law, it provides individuals with developmental disabilities with control over their own individual budgets, and individuals can utilize the funds to tailor the supports that they receive. And the Autism Omnibus Law expanded DDS eligibility criteria to many persons with autism, Prader-Willi syndrome, and Smith-Magenis syndrome. And before this law, the traditional form of eligibility was just based upon an individual's intellectual disability. So this law has expanded it to individuals with autism, Prader-Willi, and Magenis syndrome that do not have an intellectual disability. And the types of services that you can receive through DDS for adult programming, for day programs, is CBDS, which is community-based day services, employment services, and something that is called Day-Hab Wrap, where it's additional staff funding. So you get Mass Health when you're in a Day-Hab, but if somebody needs additional staffing, there's an opportunity to potentially get additional staff funding through DDS. And we'll talk about these programs over the next couple slides. And then the Massachusetts Rehabilitation Commission is another funding source. And for rehabilitation, individuals with acquired brain injury or traumatic brain injuries are eligible for MRC funding for rehabilitation. MRC also funds vocational rehabilitation services, and these are for individuals with physical, psychiatric, and developmental disabilities that impedes ability to find or maintain employment. And the process for receiving vocational rehab services, if you schedule an appointment with your local rehabilitation office, they'll help you through the application and eligibility process. And once a job is obtained, MRC will provide support, advocacy, and follow-up services for at least 90 days. However, you may be eligible for up to 3 years until your case is closed. And so as I mentioned, that we would discuss the types of day programs, the day habilitation, community-based day services, and employment services, both individual and group. And Carol's going to tell you all about day habilitation.
Hi, so the next slide is entitled Day Hab Profile. Typically, the Day Hab services would start for a person at 22 years old, but occasionally families or schools along with DDS may opt for or request an earlier admission. And that all needs to be worked out between the parties, but it is possible. The day hab also accommodates individuals who are either ambulatory or non-ambulatory. What we've noticed is that as we've had more turning 22-year-olds coming into the program, and the people who are non-ambulatory come with a lot of equipment these days. So oftentimes the schools will prepare them for the transition, and they will have a wheelchair, but in addition they may have a stander or a walker or a gait trainer. So the day habs are able to accommodate people who ambulate, but also people who are non-ambulatory. The needs of the individual must be able to be accommodated with ratios of 1 staff person to 4, up to 1 staff person to 7. When a person comes into the day hab program, we take a look and assess the severity levels or the need levels, and that's how the staffing ratios are determined based on the results of the screening. Possible additional funding from DDS can be sought when a justification is submitted, and that would affect the ratios. That's usually referred to, as we said before, as day hab wrap. Day hab programs are a maximum of 6 hours a day and can be full-time or part-time, and actually can also be combined in a hybrid program combined with employment, and that'll be discussed with DDS as a possible option, and that's usually, again, a team decision. A person is referred to the day hab, and actually that kind of program is referred to as a therapeutic day habilitation service. When the person is referred, if they're accepted into the program, there are assessments that are done by a variety of people, and a therapeutically focused program is developed for them with individualized goals and plans for the future. So there are goals, and under those goals are also objectives. So the therapies that are involved, there's physical therapy, and some of the services that discipline provides might be seating clinics, out-of-chair initiatives. In other words, people who are in wheelchairs are up in the stander or walking for some portion of the day or the week. There could be formal and informal exercise programs, stretching, wheelchair driving skills, and also just gait training and ambulation. Occupational therapy brings a lot to the team, and they do a variety of things, sensory assessments and treatment. They have cooking groups that they run, focusing on meal preparation, but also just on the skills that are part of meal preparation, chopping, cutting, mixing, so on. They work on activities of daily living, so things like self-care, toileting, grooming. Occupational therapists also make requests for adaptive equipment. That's actually often done in conjunction with the physical therapist. So they will write the justification for the adaptive equipment and or even make the order for purchasing the weighted spoon, the plate with the lip, and so on. Occupational therapy works on scheduling and time management skills, as well as money management skills. Some of the other things they do are computer access skills and working with individuals on self-advocacy. The speech-language pathologist, another member of the team, provides a variety of services, among them augmentative, alternative communication, consultation and training, so that's AAC training. They do swallowing assessments for people who have had changes in their ability to swallow, and also guide the selection of the appropriate diet for that individual. Included under that is a special service called Modified Barium Swallowing Study, MBSS, kind of cavalierly described as a video, and it's a moving picture, basically, of the swallowing process so that the speech-language pathologist and the other members of the team can actually view how safe the swallow is and then make recommendations for the appropriate diet. Speech pathologists also work on social communication skills and basic problem-solving skills. All of that is done after an initial assessment and actually ongoing assessments, too, as needed, and at least annually. Another service that's part of the team is expressive therapy. That can include music, art, drama, dance, and that service actually also provides supportive counseling sessions using art, music, drama, and dance as the vehicle for dealing with some of the adjustment issues that an individual might be experiencing. Behavioral supports are a component of the team, and they work very closely with all the staff in the DAHAB to train them in positive behavior supports, which is an initiative that's come out recently for DAHABs. They also work on crisis prevention training. At Charles River, we have recently moved into the new program Safety Care, but there are other programs that are also available for this. So there are, as I said, there are a variety, and it's crisis prevention training. The behaviorist also oversees the behavioral supports that are provided. And then last but not least, an actually very important key component is nursing. So the nursing staff are available on site throughout the day at the day habilitation program. They do a variety of very important things, nursing administration, medication administration. They can provide special medical procedures such as catheterization or skin checks. They provide ongoing health monitoring, weights to monitor someone's well-being, maybe monitoring for oxygen levels and so on. They do staff training for things like diet modification. They do dietary monitoring, so it is the responsibility of the nurse to keep an eye on the level of diet consistency, and are the staff that are providing the feeding, are they providing that at an appropriate pace, giving appropriate cueing, and so on. They act as a health management liaison with the doctors. So when an individual is having a difficult time or experiencing some medical issues, they may actually contact the physician's office and discuss with the physician their concerns. And they provide assessments and referrals. They're a very strong support for the health and well-being of the individual, and they work very closely with the family. Actually, we have our healthcare supervisor, the RN in the program, contact every family prior to admission, just to be sure that there's a clear understanding of what's needed from a medical standpoint. The Day Habilitation Program is a goal-focused active engagement program. So that means that there are daily therapy goals that are developed by the team. And the team, again, is the therapists, the staff in the DAHAB, nursing, the managers in the DAHAB, and most importantly, the families. Goal-focused activities also include art, music, drama, dance, Zumba, gardening, and other things that can be provided for the enjoyment and participation. But while people are enjoying it, they also can be working on goals. We have club activities, so there's a variety of clubs, walking clubs, cooking club, so on. Community integration is an important part of the DAHAB. Trips to parks, hiking, library, shopping, and all of that, of course, is goal-driven and needs to be focused on making progress of even the smallest amount, but showing that there is some learning taking place in the process and in the context of the community. We have special events, so there are holiday dinners and door decorating contests. My group's very competitive, so they particularly like the door decorating contest. We have volunteerism. We go to food pantries. There are senior shopping opportunities. Many programs participate in Meals on Wheels. They can do recycling. Computer-based activities are part of the Day Hab, and that means that an individual could be researching how to get to the grocery store, or, you know, the details of Johnny Cash's music history. Also, some people have email accounts that they manage with their families. We have therapy dog sessions, current events review, sports competitions. And one of the key things is that the individuals in the Day Hab cannot engage in paid work or pre-vocational skills. However, the Day Hab is about life skill acquisition. So skills like turn-taking, problem solving, following directions, and social skills all contribute to growth for the individual. Here's Heather.
Thank you, Carol. Next, we're going to talk about the Community-Based Day Services, CBDS. Typically, individuals start at this program at the age of 22, and it is known as a pre-vocational training. They sometimes call it a pathway to employment. Sometimes individuals may use it as a supplemental service if they're working part-time and they need structure during the days that they're not working. And after evaluations are completed, we identify intensity scores, and those determine what the funding level, basically what also the ratio needed for each individual. And typically the average is about 1:5 staff to participant ratio. And in the community-based day supports, as they keep referring to it as CBDS, you'll hear that a lot. It's an array of services designed to enrich a person's life by developing, maintaining, and enhancing competency in personal, social, and community activities. Our goal is to support individuals to become independent and active members of the community. And we do this in various ways. Through career exploration, we use interview skills, visiting local businesses, resume building, internships, many other things. I'm just listing a few under each category. Of course, community integration is a huge component of a CBDS program. And we go into the community with volunteering, recreational opportunities, as well as travel training. And some of the volunteer sites that we go to at Charles River, Meals on Wheels. We also do senior shopping, where we shop for seniors in the local area. We go to food pantries, buddy dogs, various things. We probably have about 17 volunteer sites for the individuals in the program. We also support individuals with skill development and training. So, for instance, money management, time management, computer training, and various other activities. And we base all of these off of what individuals' annual goals are. We determine what types of activities to offer based upon individuals' goals. We support individuals with independent living skills, teaching activities of daily living, so cooking, just general life skills, maybe appropriate weather attire, safety skills, grooming for preparing for on-the-job, shopping. Community safety is a very activity that we offer a lot to ensure that everyone has community safety skills as we spend the majority of our time in the community. And health and wellness is a big one, and this is also something that families are always asking about as well. So we offer a lot of exercise and nutrition planning. Socialization, this can be achieved through peer mentoring, doing a lot of self-advocacy within the agency as well as outside the agency, and of course teaching communication and social skills. And all of this can only be achieved once you identify what individuals' interests and hobbies are. And as we go through that process, it needs to be person-centered and, of course, goal-focused, as I mentioned, and absolutely choice-driven. Individuals need choices in order to help with decision-making for the future. And for individual employment, this service supported by DDS, it's an array of services designed to assist individuals obtain and maintain community employment, also supported by MRC, Mass Rehab Commission and Mass Commission for the Blind. We provide assessment, career planning, and of course skills training, job development and placement. And once a person's placed in a job, we do provide job coaching. But with individual employment, the job coach does fade. The staff does not stay there one-to-one. But we do provide ongoing services. So once we feel that the person has mastered the job, we begin to fade. But we do go in periodically depending upon the needs of the individuals, and do observations, as well as we're in close communication with their supervisor. But during this whole process, the most important part of this is to find natural supports within the job site so the individual can be successful, even more successful, when the staff is not present. Transportation is sometimes an obstacle to community employment. Many providers do offer transportation to job sites. However, as we're teaching independent living skills, it's always important to find and teach individuals ways to get to work on their own. So always provide travel training as well. And as you're making money, you need to ensure that it's not going to affect your benefits. So providers also provide benefits counseling. And as some individuals, if they're not prepared and ready for individual employment, group employment is also a nice option. For group employment, we do career planning and situational assessments similar to individual employment. And group employment is where small groups of individuals will be working in a community setting, and a supervisor stays on the site to provide job coaching and ongoing supports. So the staff is always present. Sometimes the group will stay together the whole time. Sometimes you might be in the same building, but one person might be working in one area while another person's working in another area, and the job coach is going back and forth to support everybody to ensure that they're following through with all their job duties. But the goal is always to train and prepare for individual employment. So as you're going through all these slides and thinking about all the services, a question that always comes up is rehabilitation program or community-based day supports. They do have many similarities. Both work on maximizing independence, they're goal-focused, and just skill building towards independent living in the community. However, I think the biggest difference is nursing needs and healthcare management. And that's where you would, in a rehabilitation setting, that's where you would get all of your nursing needs and healthcare management needs, as well as therapeutic needs like occupational therapies, physical therapy, and speech therapy. Alternatively, the difference for a CBDS, the community-based day service, and employment opportunities is you have the ability for paid work. As Carol had mentioned earlier, when you are participating in a rehabilitation program, there is no opportunity for paid work. So those are the two biggest differences. And as you're going through, you have to go back to your vision and figure out your individual interests and your preferences based upon an individual's skill set to determine what types of services And then also remember that they're not exclusive. You can have hybrid programs. You can do a split between day hab and CBDS if you're not quite sure of what to do. And that's something that you can talk to your funding source or different providers about how all that works, if that's something that would be beneficial for an individual as they're moving towards adult services. And Carol is going to sort of summarize what we talked about in terms of how to pull it all together when you're starting this process.
So I'm going to summarize by talking about where to start. Start looking at programs for your loved one around 18 or 19 years old. But in truth, you actually are doing that to educate yourself. I think that that's a little far out from a start date, so you probably educate yourself and then go back to the programs that you've found appealing or that you think would be a good match for your family member. Things to have in place already, we talked about the vision and the personal profile. That's work that is done by the team prior to the 18th birthday and is something that really maps out a plan based on the individual's profile and personal preferences, which is always to be considered in terms of choosing a program. Assessment of need areas, so there are some assessments that are done outside of the day program or employment program, and that includes medical assessment, behavioral, and clinical assessments. The individuals that come into the program have usually had extensive assessment done as part of their school experience. So those are reports that we often request, occupational therapy reports, physical therapy, speech-language pathology, and behavioral information all comes with the person when they start in the program. Securing funding sources, we talked about that earlier. Know what your options are, gather information, look on websites, and then tour programs close to where you think the individual is going to be living. If you think your family member is going to be staying at home, look near home. If you think that they might be living in a town or another home elsewhere, look in that area. Do transition planning with the school personnel and start preparing your child to the idea of moving into adult services. It's time for you to move on, and lots of opportunities await you in the adult world. So we like it when families really talk up the future and look positively towards what is going to happen and what possibilities there are for the family member and for the family. The last part of the presentation actually lists some resources, and Heather's going to talk a little bit about that.
Before I mention the resources, I just wanted to add into what Carol said in terms of preparation. One thing to note is that ratios are quite different from school systems to adult services, and that's always a dilemma for family members to decide how to proceed as you get closer to when the individual is turning 22. Do we start to fade some of the support? Do we keep going with as much support as we can to maximize learning and independence? It's a personal preference and as well as need. It all depends on the individual, but it's something to consider as you're planning and through the individual transition plans that are put together as you're getting closer to 22. Do we continue with the same ratios to ensure that the person learns as much as they possibly can, or do we prepare and start to fade? And not necessarily fade the staff altogether, but just maybe think about having less prompting, or maybe the person might step back a little bit when they're job coaching. it really all depends, and it's going to be a team decision, but thinking about the whole process, because it is a reality. When you do get into adult services, the ratios are very different, and they're not as high as in when the kids are in school. So in terms of resources, how to find all of these things we have just discussed. The first link you'll find, this is a link to all the departments in the Executive Office of Health and Human Services. That's where you'll find a link to the Department of Developmental Services, Mass Rehab Commission, Mass Commission for the Blind, and as well as Mass Health. A lot of this information that we talked about today you can find in the DDS Transition Fact Sheet, which is also on the mass.gov website, and also a link to the Charles River Center. And I also wanted to note, where do you find these services? The ARC of Massachusetts has 18 chapters in Massachusetts, and the link is actually not here, but you can access this to find providers in your local area through the ARC of Massachusetts through www.thearcofmass.org/about/chapters. And that will, it has a list of all the ARCs, their addresses, telephone numbers, websites, and who to contact. And you can get information, and that's where you can begin to look at websites and start to tour programs and just gather information for the next steps ahead. At this point, we would like to open it up to any questions that anyone may have.
Yes, hi. Thank you, Heather and Carol, for that really informative webinar tonight. And I just wanted to remind people to ask a question. At this point, I can't unmute you because the sound quality is not good when I do that. So if you could just chat in the question to me and the presenters down on the bottom, we'd be happy to answer some. So I had a quick question. What are the ratios of staff to the participants in a community-based day support program?
They can range from anywhere from 1 to 2 up to 1 to 8. I think moving forward, they're realizing that it's for when you're out in the community, it's better to be at more of a 1 to 5, 1 to 6 ratio. So I think moving forward, the ratios are coming down a bit. But the range right now is typically 1 to 2 to 1 to 5, 1 to 6.
Okay, thank you. We do have a question from Sarah. Does the Real Lives bill include the self-directed model?
Yes, that is part of it. It is as your it's an option to sort of determine what type of services you are interested in obtaining. If you're not following under sort of the guidelines through the evaluations and intensity scores, then you can kind of tailor your the services that you're going to receive. The one thing that should be noted, although you should explore this through DDS, as they'll be able to provide much more information. But as you're doing this, it does become management on the family's part or whoever's identified to manage the funds for the individual, because DDS traditionally manages all the funds. So individuals will come, parents or family caretakers will support them to figure out what type of services they want, and then DDS handles all of the funding and financial aspects of it. When you do self-directed stuff through the Real Lives and different things like that, you have to get much more involved in the management of the funding. So not to say that it's a bad thing, but it's just a reality that there's a little bit more work involved, a lot more work involved on the caretaker as well as the provider.
Great. Hopefully that answered Sarah's question. Anybody? Okay, yes, she said thank you. Okay, good. How about somebody else? Does somebody else have a question? I just also wanted to note that the newly eligible through the Autism Omnibus Law, autism only without an intellectual disability, are also able to access now a coaching pilot, which is a one-to-one coach or mentor to work with somebody around, can be employment, can be independent living, or whatever. So that's something too to keep in mind if you do have a son or daughter that has autism without an intellectual disability. Does Charles River provide that service, or are you one of the vendors for the pilot?
We just recently began supporting several individuals through our Family Support Department as well as our Employment Department. And we actually just supported an individual to have their first job at the age of 32. So that was very exciting. It was
great.
Very, yeah, it was great. It was very
good. Good.
Yeah.
All right, and Stacy has a question. So with the closing of sheltered workshops, how is that affecting DEHAB and employment programs? Is more money being funneled into employment services?
Well, in some instances, yes. There's individuals, as they were leaving sheltered workshops, team meetings were held and discussions on community-based day service, employment, or DEVELOPmental, and between the whole team, it was determined on the plan was to be determined on preferences in terms of what services the individual is interested in. And but yes, the money from the sheltered workshop was moved into employment and CBDS programming. And depending upon how much was funding in each contract was determined about who was to get it.
Okay, good. I had another question for you. When you mentioned employment and you talked about natural supports, could you give some examples of what a natural support is in a workplace?
Absolutely. They could be just the coworker, a coworker who we found has just built a rapport with the individual. They may have a family member at home with a disability, and we find that actually if people have experience with people with disabilities, they just naturally become their support. Just on their own. There are times when we actually may send a job developer in to kind of get to know everybody, and we've actually asked people if they can sort of be their go-to person if they have questions, if their supervisor isn't around. Or you may just talk to the supervisor and just ask who might be a go-to person if you're not available in a moment, where somebody might just have a simple question if the job coach is not available.
Great, great. So, any other questions from the audience here? I did want to note that you know, funding for day and employment services, not DEHAB, because rehabilitation is an entitlement, and you know, can be not always easy to obtain to get everything you want. And so, you know, it's leaving the world of entitlements to the world of eligibility. And the funding for all of the DDS support and employment programs are through state dollars. So we need your help and your advocacy and your support in terms of making sure that money is there. Sarah did ask a question. What exactly does a DEHAB case manager mean?
Well, I think, this is Carol Alden. I think the term case manager varies from program to program. So, and also actually varies in settings day hab versus a hospital. You may have heard that term in the hospital. The day hab case manager is a person who oversees the goals, progress towards the goals, and also does a lot of the documentation and kind of pulling it together to make a report. So at the Charles River Center, the case managers are in the room, and they act somewhat like a head teacher to just oversee the whole operation in the room. But then the other half of their job is actually to also take the information that's collected, the data that's collected, assess whether the person is making progress on the goal, adjust the goal in cooperation with the rest of the team, adjust the goal if necessary, and do the documentation for all of that. So they produce monthly reports summarizing the documentation. They do a look back of a quarterly report, which looks back over the past 3 months, and then they prepare for the DAHAB service plan, which is an annual report that is a look back over the whole year, as well as an outline for the upcoming goals for the year. Does that explain the role of the case manager? In other settings, actually, I guess the case manager is not in the room, does not serve as the leader of the room, but actually is primarily a behind-the-scenes person that handles the documentation, deals with the data, and so on. They are a liaison with the family in both situations, and they can really be the person that's pivotal to the whole experience, I think, for the individual in the DAHAB program. Are there other questions?
Yep, so we have another question from, and Sarah says that answered her question, thank you.
Good.
From Kevin, my autistic son is 19. What funding sources will he likely be eligible for?
Well, depending on the need of your son, Mass Health is a funding source for the DAHAB, and for other day services and employment, I think there are actually more options. I think it can be, yeah, here's Heather. She can actually fill you in on that. So for the DAHAB, Mass Health would be the funding source, and she'll talk about the employment services.
So for individuals with autism, as it mentioned, the Autism Omnibus has opened up, expanded the DDS criteria for eligibility. Traditionally, it was, the definition was by it having an intellectual disability. So if your IQ is below 70, you were eligible for DDS services. And now it's opened up to individuals without an intellectual disability that have autism, Prader-Willi syndrome, or Smith-Magenis syndrome. And there's various other criteria that you would need to have if you didn't have an intellectual disability. So you might need assistance with self-care, receptive and expressive language, learning, mobility, capacity for independent living, or economic self-sufficiency. So if you were interested in going through the Department of Developmental Services, if you contacted your local DDS area, they can explain the process and if the person may be eligible or not. Quite often, if somebody's not eligible for DDS services, many family members or whoever will go through the Mass Rehab Commission to see if they can get funding for vocational training. And, private pay. Oh, and also private pay as well. So those are the various types. And if you're just not sure where to start, you can always start at the CAP program, the Client Assistance Program. And they can guide you through this process on who you should call first. They're a free service, and they will guide you through the whole process of funding and where to go and sort of where to start.
Okay, terrific.
Okay.
Anybody, we've got a couple of minutes left. Any other questions?
While we're waiting for questions, I just wanted to sort of reiterate what you had said about advocacy, because to sort of go a little bit further with what Stacy had asked about the funding. Yeah, there's only a certain amount of funding in each contract, so you may not get all the services that you're interested in. I think that's why some people like the idea of the self-directed funding, but continued advocacy and calling your local state reps and stuff to advocate for disability services is a must, and we do it all the time in conjunction with the ARC of Massachusetts, who is always a great advocate for disability services. So thank you for all your assistance.
Okay, great. Okay.
Yeah.
All right then. So I wanted to thank our presenters tonight, Heather and Carol from the Charles River Center. You've been a great, it's always great to hear the expertise and trying to understand all these acronyms and also what programs really do provide for our kids. So we're going to end the session, and at the end of the session, you'll be rerouted to the ARC of Massachusetts website to complete a brief five-question survey, and your feedback gives us valuable input as we continue to develop our webinar series. So I hope everybody has a great evening, and thank you again. We are having 2 more sessions in November. And one is going to be on advocacy and how important it is. It's really essential. You can go on our ARC of Massachusetts website and also look at our Supporting Families of Massachusetts page, as well as we'll be getting an update on Mass Health Innovations. And there's lots of things that are changing and will be changing in the future. So it's important that everybody stays on top of it. So again, thank you all so much for joining us tonight. Have a great night.
Thank you.